Phacoemulsification step by step for beginners. First of all, you have to decide where you are going to make your main incision. It's better to make it here at 10 or 11 o'clock, better than 12 o'clock, to make it easier to enter with your phaco probe. You have to make the wound of average length of about 2 mm. So use the keratome to enter the cornea to pass intrastromal within the corneal tissue before entering the anterior chamber. Regarding your left side port, make the left side port with 90-degree angle with the mini incision to make it easy to chop the nucleus, and the other side port to be 180-degree from the first side port. Here we use trypan blue stain to stain the anterior capsule to make it visible for capsular rhexis. Then inject viscoelastic material to flatten the anterior capsule. Use a 27 gauge insulin syringe to make a puncture inside the anterior capsule, and try to aspirate as much as you can of cortical matter to avoid rhexis extension and Argentina flag complication. Now you can raise your flap using capsular rhexis forceps, trying to make capsular rhexis of about 5 mm. At any time, if you feel that the rhexis is going to extend to the periphery, you can pull the flap toward the center to avoid this complication, which is known as Little's technique. In such cases, I find it a bit difficult to make a groove due to emulsified cortical matter and very large nucleus, which make the nucleus rotate. So I can find it easier to do a direct horizontal chopping and to chop the large nucleus into multiple pieces to be emulsified. In such cases, you will not find a lot of cortical matter due to liquefied cortex. After emulsifying the nucleus, now you can enter with your bimanual radiation aspiration to remove the cortical matter. During IA of the cortical matter, try to enter with the aspiration toward the equator, inside the bag, and try to aspirate the cortical matter and do swinging movements like this to engage as much as cortex as you can, using the vacuum until hearing the sound of the vacuum rises in the phaco machine. Then pull the cortical matter toward the center with increasing the vacuum until aspiration of the cortical matter completed. Now you can fill the anterior chamber and the bag with a viscoelastic material, then implant single piece intraocular lens inside the bag. You can use your Sansky instrument or spatula, small spatula. 2. Rotate and dial the intraocular lens within the bag to make sure that both haptics and the optic inside the bag. Bimanual irrigation aspiration is used to aspirate the viscoelastic material to avoid post-operative intraocular pressure rise. Then use your BSS to do stromal hydration to close your side ports and the main wound, to seal it, and to avoid aqueous leak. Thank you.